Have you ever felt helpless watching your mother, your father, children, friends, or loved ones suffer from an illness? When I was a boy, my mom was attacked by autoimmune disorder called multiple sclerosis, which affects 1 million people in our country. That suffering started me on my journey and my mission of bringing healing and freedom to each of us. A journey that brought me to this stage today, where I'm honored to be able to present to you a groundbreaking development in the field of medicine and ask you a simple question. What if we could harness the power of artificial intelligence to fundamentally transform the way we discover medicine? The COVID vaccine was designed by computers in a matter of weeks. Just think if we could apply that same technology to the creation of antibodies, some of the most impactful medicines on the planet. Antibodies play a crucial role in our healthcare system and have very likely helped someone you care about. Antibodies are used to treat cancer, a disease that my father has survived twice. Antibodies are used to treat multiple sclerosis, a disease which still attacks my mother. Antibodies are used to treat infectious diseases like COVID that has affected every single person in this room. In fact, last year, other than the COVID vaccine, the #1 and #2 selling drugs in the world were antibodies. Yet despite their massive impact on our lives, the journey from antibody discovery to clinical trials is a monumental challenge with a 90% failure rate and a cost of up to $50 million. Those failures put us further and further away from having antibodies for those that we love. It's clear that we need a fundamental change, and that's where we come in. At Evolve, we're solving this multi-billion-dollar problem by using cutting-edge artificial intelligence to replicate the process of how antibodies become drugs. Our technology can reduce the millions spent and years of time performing antibody discovery for pharmaceutical companies and biotechs around the world. Our team is made up of experts like Boris, who brought antibodies from discovery to approval at Pfizer, and we're advised by authorities in the field like Victor, the world leader in computational antibody design. Antibody discovery hasn't changed much in 20 years, but with our skills in artificial intelligence and antibody discovery, we've been able to build tools that fundamentally transform the way antibodies are discovered. Our technology has even outperformed Google's state-of-the-art protein prediction algorithm, AlphaFold. And what's the result? Antibody discovery with a success rate that is more than 10,000 times greater than conventional methods. With traditional antibody discovery, our customers have to search through billions of antibodies just to find 1 or 2. But we used our technology to design just 90 and found 5. And this kind of success in the lab has led to 12 signed deals. So how do we make money? Well, we don't sell software. Instead, we use our technology to generate intellectual property that we license to our customers, biotechs and pharma companies. They test our antibodies, they pay us to test our antibodies, and when they work, we can earn millions more in milestone payments and royalties. Just a year after founding, we generated nearly $400,000 in revenue, not including the milestones and royalties that we are associated with our antibodies that we've licensed to our customers. And those milestones and royalties have an estimated value of $16 million. And that's just for 5 of our 12 contracts. And as our licensed antibodies move closer and closer to FDA approval, the value of these 5 contracts grows. So at a phase 1 clinical trial, they jump to $59 million. And we're just getting started. We're in active discussions with 23 drug discoverers, including 2 of the top 50 pharmaceutical companies. So what does all this mean? It means that whether you're an innovator, a potential team member, or an investor, you can invest in Evolve's technology and help create a portfolio of lower risk antibodies that can accelerate the future of medicine. Every person here knows that we need to change medicine. Because regardless of fluctuations in the market and no matter the challenges we face, the people we love will always need healing. So given the opportunity to do something to bring healing to those we love, will you take it? Are you ready to join us on our mission to evolve how medicines reach those in need? Thank you.